Welcome to today's episode where we dive deep into the transformative world of psychedelic-assisted therapy. I'm joined by two incredible experts who are at the forefront of this cutting-edge healing approach. First, we have Shira Myro, a couples psychotherapist with nearly 2 decades of experience. Shira specializes in complex trauma and attachment disorders, blending traditional therapeutic techniques with innovative approaches like MDMA-assisted therapy. She's passionate about helping individuals and couples heal through emotional resilience, intimacy, and connection, with a special focus on how psychedelics can play a transformative role in their process. Also joining us is Dr. Alexa Altman, a clinical psychologist with 20 years experience and a deep spiritual perspective on healing. Alexa has worked extensively with trauma, depression, anxiety, and life transitions, incorporating a variety of therapeutic modalities like EMDR, somatic experiencing, and internal family systems. She's also a recognized psychedelic integration practitioner through MAPS, exploring the powerful potential of MDMA and ketamine in therapy as tools for healing. Together, Shira and Alexa bring a wealth of knowledge on how psychedelics are changing the landscape of trauma recovery, from MDMA's potential in couples therapy to ketamine's role in emotional healing. Today's conversation is all about the research, the practice, and the profound impact these therapies can have on our ability to heal, grow, and reconnect. Let's get into it. Thank you both so much for joining me. I am super excited about this conversation. I get tons of questions about alternative therapies. Am I going to become addicted? Is it going to make me have a schizophrenic episode? I have schizophrenia in my family. We have a lot of things to get through. First of all, I would love for each of you to tell me what brought you to psilocybin or alternative treatments. I'll start with you, Alexa. How did you find yourself here?
Yeah. So there was that moment that I'll never forget. And I had a patient, I'll call her Robin, and she came to see me for depression, treatment-resistant depression. So antidepressants, multiple have failed. And she sought all different kinds of treatment, alternative other treatments. And she came to see me for the very typical classic signs of depression, right? The negative self-talk, barrage of criticism, feeling like a burden. She couldn't get out of bed. She couldn't really progress in her life. And I just remember the moment she looked at me and said, is this going to be a life sentence for me? Do I just need to accept that most days are rainy and gray, and sometimes I have an umbrella and there's a little reprieve, but for the most part, I'm going to live rainy.
Yeah, this is my life.
This is
and
my
the weight
life.
of depression. And it's so helpless feeling as a therapist when you're like, I'm doing all I can do. Like, shit.
Right. I had to look myself in the mirror as a treatment provider and say, there are a lot of patients that our current mental health treatments are failing, and it's just not good enough. And so went down that rabbit hole of doing research and new emerging therapies. And I think the other piece that hit at that time of really the discovery, right? 90% of Americans believe we're in a mental health crisis. 1 out of 3 women are depressed. 1 out of 5 men are depressed. We are in the midst of a mental health crisis. And I went down the rabbit hole of exploring psychedelics, researching, and everything I thought I knew about psychedelics was wrong. And everything I thought I knew about psychedelics was really based in the history.
Like stigma almost.
Stigma, fear. 60s counterculture, the war on drugs, which I think we'll get into a little bit more. And so I just felt compelled, the research was so undeniable, to go do some training and explore what else I could provide patients as a treatment choice where they had reached the ceiling of their treatment so far. And so that's how I landed in this space of being able to provide the approved psychedelics, FDA-approved psychedelics, and also be on the edge of, these new and emerging psychedelics, or some are very ancient and old, when they do get FDA approved.
Yeah, because even though they've been around forever, they're not approved for, it's not legal. And I find that to be so interesting because it's usually like we have a new drug that we've just come out with and it's this new mechanism of action and it's going to be life-changing. But this is like, no, we've had these things growing. We've had these things happening in our world forever, for all our lifetimes, yet we haven't utilized them to like their fullest extent because of, and we'll get into that, like the fear, stigma, you know, whether it's like, we can even go down a reefer madness type of conversation because I find that stuff so fascinating. But yeah, it is interesting when you feel like your hands are tied. Like there's only so much you can do. And you're like, I don't know, this could be a life sentence. That's super, I mean, you know, we're talking about depression, but that's super depressing. You're like, well, shit, then what am I doing? Like,
right. Waiting for that breakthrough treatment. And then to discover that there are many breakthrough treatments available for people suffering.
And how about you, Shiro? How'd you find yours? Because I didn't know of you until obviously Alexa was talking about all the stuff you guys are doing together.
Yes. I think my entry into psychedelics was my own individual experience right before COVID, so like 6 years ago.
Wow, that just blows my mind.
And I'm a couples therapist and a trauma therapist, but the power, the transformative power of that experience just blew my mind. I had, like many people, taken psychedelics and drugs in an experimental way in my early 20s and stupid, reckless way in my 20s.
That's what 20s are for.
Yeah, there you go. And I was so blown away by the context of the application of it. My first experience was MDMA. And there was just no going back. I thought, this is incredible, the power of this, the healing potential of this, and it sparked my curiosity. I met Alexa through MAPS. We did our initial trainings through MAPS, the Multidisciplinary Association for Psychedelic Studies, which is the main body that's been doing the trials in conjunction with the FDA, the clinical trials for PTSD. And my world changed. Like never in my wildest dreams would I have thought I would get into this work, become a facilitator, become an advocate for this work. But I think I was also running into, especially with couples, a block, a wall, where they would do a lot of work, they'd get some insight, they would reconnect at times, but oftentimes they just could not deepen. They couldn't sustain intimacy. We just kind of hit this place where they couldn't break through. It's not to say that some couples don't, because a lot of couples do very well.
Of course, but but some run into this wall.
Where psychedelics offers a way to really deepen and expand and create space. It's a catalyst and an amplifier, and it does these things in a way that conventional talk therapy isn't always successful at doing. So that, I think that was the entry point for us to connect and to study and to also realize, as Alexa said, so much of what we know, what we think we know about psychedelics is there's a lot of misinformation floating around.
100%. And I think there's judgments about it, and people, I experimented, or that's for people who do drugs. People will think things like that. But there was a study I read, I don't know if I read it in Bessel van der Kolk's Body Keeps the Score or if it was other research, but it was when I was researching for my last book, Traumatized. There was some research to prove that talk therapy itself only works for about 40% of people. And even as I read that, I went, yeah, like that sounds reasonable, because just talking about it, we can't always go there. We can't always stay there. And defenses are so constant, or at least even personally in my own therapy, like, you get defensive about things without realizing it because you're protecting yourself. If I put myself out there, there's so much to navigate, not to mention if you have trauma, then there's a whole other layer. But sometimes it feels like this isn't enough. Is this going to be the rest of my life? So for people who are in therapy, maybe feeling like I just keep hitting this wall, or I'm in couples counseling and it's just not getting anywhere, how does psychedelic therapy differ? So like I go in to see my therapist and I sit down and like verbal diarrhea everything that's happening because that's who I am. And then like help me make sense of this or give me some tools. Is psychedelic-assisted therapy similar, or what's it look like for people?
That's a great question. It also depends on the psychedelic medicine we're talking about. But let's just use ketamine as an example, since it's currently, I think, a little more widespread and known for the treatment of depression. So typically what it would look like is you'd go in for an intake, a thorough intake to assess if you're appropriate for the medicine, right? So we're going to look at the medical history, the psychological history, looking to see if there's any other risk factors that make you not a good candidate. We can absolutely talk about that. So after that thorough intake, then there's a few preparation sessions, getting a person familiar and comfortable with what the medicine might look like, like what the session will look like, what it's going to feel like, fears they might have, what they're coming for. We get really focused on what their main intention is.
So like, what are your main symptoms? Like your problem, like the most problem, like, I don't know, is it like how you're experiencing your body, or are you looking for like, hey, I need my relationship to be better? How specific are we talking?
That's a great question. Sometimes the intention can be symptom relief.
Okay.
Like, I want to feel like there isn't an elephant on my chest every day, right? Sometimes it's, I need to let go of this anger and resentment that I carry around. I would like to move towards forgiveness. Sometimes it's can be the release of something, or I haven't experienced joy. I'd like to bring joy in and just experience, or safety in my body. If, lots of traumatized folks don't feel safe in their body. So we dial in to get really clear and focused. What are we trying to accomplish here? And so the psychedelic journey itself, and Jerry, you can elaborate more. Traditional talk therapy, there's this cadence and reciprocity that goes on, and we have a certain way. In a psychedelic session, a person often has an eye-fold, mask on, not always, and music playing.
Oh, interesting. So there's no eye contact.
There can be. Everything is a choice.
Yes, that's always like therapy. Each person's different. There's no prescription for all.
Right. So
Which drives people crazy.
Am I doing this right? I was like, does it feel good to you? Right?
Are you comfortable with this?
Are you comfortable? Some people really want to stay engaged the whole time. But part of the eye mask and music is this, the concept is that when you go inside of yourself, there's this whole interior landscape that comes alive. And that can sound very scary for people. They're like, what's coming alive? But the truth is, what comes alive is oftentimes lots of wisdom and lots of things you haven't seen about your own self-experience that becomes amplified.
Yeah, because I do think I love journaling for many reasons, but the main is the fact that we often know the answers to things. We just don't take the time to ask ourselves. We're so used to either asking someone else or looking for other validations versus considering, like, do I want to do this? Why does this feel so uncomfortable? And to sit in that is often impossible.
Right.
And there can be a lot that comes up for that, especially if you don't feel safe in your own body. But that's really interesting to me, that it's like almost like all those answers that we had hidden come to life.
Yeah, and the chatter, the typical chatter that goes on, right, that neocortical loud conversation's quieted down. So you really get to hear from so many other parts of yourself that I wouldn't even say are dormant, or just overpowered.
Yeah. Defenses are louder. Fear is a big motivator, right?
Yeah.
Fear shouts and hides other things. Yeah.
And the facilitator takes more of the back seat. So if you're thinking about, you were saying the conventional method of the back and forth, really the conversation to be had is between you and the medicine. We sort of like to call it that. There's the inner healing wisdom, and then there might be parts of yourself that arise oftentimes when you're inside. And so the facilitator's role is to keep you safe, to protect the container, to really hold the space for these other parts of yourself to come forward. So that is a big distinction between conventional psychotherapy, talk therapy, and medicine work, psychedelic therapy. It's also a little harder to, even though let's say your goal might be depression relief, or, people are also coming for spiritual awakening or deepening, or maybe life transitions, or they're in a question that they're really struggling to find the answers within. So it doesn't necessarily have to be depression, anxiety,
trauma. It can be.
Trauma, right, like that. Of course, yes, of course. Those are the big issues that people often think about psychedelics, and a lot of the studies are sort of based around alleviating that kind of symptomology. But people are coming in with these big questions that are lacking resolution. And so the psychedelics, almost all of them in different ways, sort of open up a internal spaciousness in that inner landscape for questions and answers to open up.
I think that is the hardest thing in therapy in general, is how do we open up and not immediately retract?
Yeah.
Because I think it's like, I don't know who it was, but I saw this guy online who, I think he's a psychiatrist, maybe a psychologist, but he has one. Do you remember those things as kids? They like expand, like you can stretch them all the way out or you can push them all the way back, and they're like spiny. If I can find one, I'll have Sean put it on the screen so you know what I'm talking about. But he shows how when people try to challenge themselves to think differently or to see something from a different perspective, or like ask themselves a tough question, it expands and then it retracts more because of the fear of like that openness of that space of like, oh, maybe, like I'm reading this book right now. I was talking to Alexa about the other night. It's called The Wedding People. And in this book, this is no spoilers, read it, it's great. She's talking to this woman who's about to get married, and she's considering whether she actually wants to get married. And as she allows herself to actually question, which she should have done a long time ago, but that's not the point, you know? But when she does that, then she finds herself like shutting down more intensely. Because it's like, oh my God, I allowed myself to maybe consider that I don't like this, or this isn't good for me, or that I'm doing this because of this reason tied to like my dad or whatever. Almost like in the process of realizing that that might be a possibility, like it's in the maybes and the mights. It's almost like we get too scared of our own honesty. If that makes sense. So this makes space for it, kind of like you can sit in that a little bit better.
Yeah.
Wow.
Yeah. I actually, when you said that, made me think about confronting the maybes or confronting the hard questions, and the idea of staying long enough to be able to see all of it. One of the benefits, certainly, of MDMA, which is one of the primary medicines for the treatment of trauma, psychedelic treatment of trauma, is all of that amygdala noise is quieted down. So like, even just in that example, the idea that you can approach scary things, these psychedelics last a long time, for a long period of time. I sometimes think about if a problem's at the center, in psychedelic, you can kind of walk all the way around the problem and seeing it from so many angles.
Which is never possible. I mean, not saying never. Therapist means like never say never. But it's still like, that's so difficult. Because especially when, I can even speak personally, like if I have a disagreement with someone, to try to see it from their perspective is really hard because you're so angry, right? And anger is obviously protective, but you're like, if I even consider that this could be the way it is, then that means something different about me. And then your internal are like, yeah, no, that can't be true. I could never be wrong. I'm right, or whatever comes up for you. How fascinating.
Well, there's an ego softening that happens. So that idea that you're the locus of control, the psychedelics, I would say all of them to some degree or another, sort of soften that grip on certainty. And I know what's true. And that kind of allows a kind of natural, you don't have to force it, kind of a natural softening and curiosity and expansion and spaciousness to hold the question or the problem or even the fear in a way that it's not sort of immediately contracting, as soon as you open up to something. And that's what's one of the things that's so amazing about what psychedelic therapy offers.
How do you choose which medication?
Well,
and what are the medications?
Yeah, maybe we should start with.
I'm like, let's start there. What are they?
The big three that are being researched most right now. So we have MDMA, which is really the front runner right now for the treatment of trauma, thanks to MAPS and their phase 3 clinical trials, and they're examining their phase 3 clinical trials. And we have psilocybin. And by the way, we're not limited to these diagnoses for the treatment of
but this
trauma.
is what's been studied so far.
Right.
It's always like, this is the beginning.
Exactly. Addiction, end of life, existential anxiety, eating disorders, OCD. They're even looking at personality disorders.
Yeah, that's amazing.
Oh, wow, like BPD and stuff. Fascinating. Because that's like, now that's in my realm.
Yeah.
Interesting. I could see that, the defensiveness, the protection. Oh, okay. And continue. I'm like, we could go down so many rabbit holes.
And ketamine for treatment-resistant depression, as we said, it's FDA approved, but not limited to. We're seeing really fascinating research right now with PTSD and ketamine, anxiety disorders, trauma. So one theory, and I think it's become more than a theory, is that psychedelics really quiet this default mode. The default mode is that part of our brain when we're not like externally focused and we're quiet that tells us who we are. It's like
It's like that ego kind of you're talking a little bit too.
right,
Yeah.
right. Like forms our sense of self,
Yeah.
right, and that it quiets it down. So this idea that we could reestablish our sense of self. So many of these disorders are just really rigid ways of thinking and doing and believing. So some people get concerned, like, does that mean I'm going to be a different person? Does that mean things are going to get rearranged inside? Well, we can't really be a different person, but rearranged,
Yeah.
potentially, in more flexible ways.
And I feel like that's like I was just thinking about this the other day, that's like a side effect of therapy in general, no matter what type of therapy, that we don't talk about enough, is that when you start changing the way that you interact with the world and the way that you talk to yourself, your relationships, your life will shift because everything's been predicated on this old version of yourself. And I think that's why we get so stuck in rigid patterns, because it's scary to consider, like, what if my best friend isn't my best friend anymore? What if my marriage cannot sustain in this way and my partner is not willing to adapt with me, right? Or,
Right.
I mean, a zillion things. What if I don't like this career
Right.
that I've chosen? I think we get so scared of change that we end up frozen in a pattern that's actually super unhealthy. So it's fascinating to think that we could remove that, because you always watch in movies and read in books, like people having these like huge life altering events, like whether they thought they might die or someone in their life passed away, that was, something happened, and then they're like, they feel freedom all of a sudden to be who they really want to be. And we read those and we love those because I think all of us kind of want that freedom.
Right.
So
To
it's like, this
secretly
could
be
give you
more
that.
of who we are. And
Yes,
to be that honest.
to be more authentic and to be
Yeah.
honest and like essentially give no fucks.
Yeah.
Like that's why that took, I mean, I know
Yeah.
it's like not the cool hip thing now, but
Yeah.
like forever it was like 0 fucks given. Like when you're out of them, people are like, ooh, that's so free.
I think old age does that too.
It does.
But
We care about less things.
I do think the window of perception, there is a cleaning of the smudge to perceive more clearly.
Yeah.
And what comes with that. And, although we talk about psychedelics and the potential of psychedelics, we can't talk about that without the arm of therapy with them. And Shira and I go on and on about this arm of it, which is the integration. You can have this profound experience with any of the psychedelics that we are talking about. And without the therapeutic arm, it stays just a profound experience, like going to Disneyland and having a great time on Thunder Mountain. But you might not carry that into your life. Just like traditional talk therapy, part of the wisdom of talk therapy is that we're weaving in some of the seeds of what we're trying to plant over and over and over again. And the same applies for psychedelics-assisted therapy. That integration component is how a person actually realizes and actualizes those changes.
And then takes it out into the world, like tries to act differently, behave in a less ego-focused or whatever way.
And the courage to do that.
Yeah, because that's the hard part, right? So it sounds like there's a ton of different symptoms, different issues that can be resolved. It's almost like it could really help anybody, just like therapy in general. So are there any specific characteristics or personality traits that make someone a good candidate? Like when you said you're doing this big background on them and like intakes very in depth, like what are you looking for?
Well, aside from, let's say, they don't have either medications or physiological issues like heart issues or brain issues or certain types of things that would be rule-outs for
Kind of makes it dangerous.
Or potentially.
At this point, they're like,
Right.
this is just safer to not.
Or because, people are taking so many medications and supplements now. So
True.
part of the research is how to figure out, you're not just, it's not just, I took some vitamin C and, some magnesium for bed. Like people just have tons and tons of things that they take and we don't know what those interactions are going to be. Also, I think a key component is some level of self-awareness. Alexa and I talk about this all the time, that if you haven't done any inner work, and it doesn't necessarily have to be individual therapy, but you don't have any sort of insight into how you operate and how you move in the world, a psychedelic journey could be an expansive and maybe inspiring or deepening experience. But we recommend people doing some therapy, some inner work beforehand, so they can maximize the experience.
Yeah, and that makes sense too, because because I think of people who, even like fellow therapists, and you guys know this too, but like psychiatrists and therapists are like, oh, I would never go to therapy. Like I'd come unraveled. And you're like, okay, I don't agree, but whatever. That defensiveness and that lack of understanding of self, the struggle to go inside, I think it could still obviously be helpful, just like any kind of therapy is helpful, but it really would not maximize it, because you might not even know what questions to ask or what to tell them your goal is.
Right.
You're like, my goal is just, what are we supposed to do here? I don't know. You tell me. It can feel very limited that way.
Right. And it's not, it's very different than a recreational experience. There's a protocol, there's a full intake, preparation, the journey day, and then this really critical piece of integration. And what's interesting too, and a little bit of a sidebar, is, when we think of psychedelics, we don't really see it in terms of like a continuum, something that has been in existence obviously for millennia, like psilocybin and some of these ancient medicines that have been used, in ritual ceremony.
Yeah, it's like peyote, or
yes,
there was that Netflix. I encourage everybody to watch this. There's a Netflix documentary called How to Change Your Mind.
Yeah, Michael Pollan.
Yes,
looks amazing too.
Yes,
so
yes.
Good.
And Sean bought that too. Okay, continue. Sorry, this is like that reminds me of that.
Well, yeah. So he tells the whole story of that. So it's not just it popped out of the 60s, right? It's been in existence for thousands of years, and then the West got a hold of it in the 20th century. It was kind of interesting. It sparked a lot of research at that time, all kinds of research, not just from, I would say, like regular research institutions, but even the government was interested in how do we use
yes,
because
then you can get into like, I did a video about this years ago, essentially about the Sean, what's it called? The madness. It's like MK Ultra.
Yes, yes.
I'm like I'm blanking on it, but that like a
very
whole
scary.
That's a whole nother podcast.
We'll say that next time.
I'll link it down below.
Yes, but so people knew these were very powerful substances, and then of course we think about the counterculture and Tim Leary and Ram Dass and a lot of wonderful things came out of that. But coming back to this idea that was like the second wave, and there were some fears around, okay, what's going to happen? Could this unravel society? Could it change the culture?
What could it do? Right, because we don't know enough about it. It can be scary.
It can be scary, and some people thought love was going to change the world, because oftentimes you will have
the 60s.
And then Nixon, and then war on drugs, Schedule I, and then it all kind of got shut down. And here we are in the third wave, where now, first of all, the type of research is done is exponentially more advanced than it was back in the 50s and 60s. And the third wave is defined by the therapeutic application of psychedelics.
Yeah, versus just like, what are these? What can we do in like
parties,
micro, macro? Yeah,
exactly. Festivals, which not to say that there can't be a place for that, but this is a huge shift, and we're just at the beginning of that wave. And there are companies that are trying to explore how can we extract the beneficial compounds outside of the psychedelic component, which is interesting too.
Yeah. Well, and so for everybody who isn't aware, when someone does a psychedelic-assisted therapy, are they getting high? And are they like, just like, is it like I roll up a joint and I smoke it and then I talk with my therapist? I know the answer, but it sounds amazing.
Yeah, I think part of what, to Cher's point, we have so many guardrails now and protocols, which safety, I think, is at the front and center of like the core value of psychedelic-assisted therapy. So to start, dosing's really important. So in a recreational experience, you don't know what you're taking. You maybe don't know dose and or substance, right? So all of that is factored in ahead of time. The set, the mindset of the person, what their goals are, the setting, it often takes place in an office, a controlled setting, a lot of time to build positive rapport, because we know the environment is incredibly powerful in informing a person's experience.
How long does it take? So if they take the pill or whatever, is it like 30 minutes and then they sit in session with, like, how? I know this is just logistical, but I'm like, how does that process work?
Well, if we take ketamine, for example, because it's, again, widespread and very popular right now, typically a ketamine session, if it's ingested orally, like sublingual, under the tongue, it's about an hour.
Okay.
So you might come in, you would have some time to talk about the goals, intention, get a person grounded. You'd have like an hour of the medicine part of the journey. And not every therapist does it this way. And then you might have an hour after to talk about what happened, what came up.
Like a debrief almost.
Like a debrief.
So do you work then, because you're not medical doctors, as like a clinician? I'm like, how does that work then?
It's great. So there's, for instance, I'm partnered with a company, Journey Clinical, and they train clinicians. That's one thing I would say, if somebody's wanting to explore ketamine-assisted therapy, to go to a clinician that has some training in it. And part of that partnership is they have psychiatrists that do a medical evaluation and prescribe that medicine.
Because I was thinking, I'm like, the CYA, the cover your ass of it. I'm like, that's a little out of our scope.
It is out of our scope, right? And we're talking about not high doses of ketamine. Sublingual, the bioavailability of sublingual ketamine is much smaller than intranasal S-ketamine, which is
like the Spravato.
Or the IV.
And that's what I've had patients do, the IV, who were like acutely suicidal, and it was like so dangerous, and there was nothing we could do, nothing seemed to help, and it was like that helpless, like we keep hitting this wall. And that was like life-changing for them. But it's also really difficult. It takes like 45 minutes. You have to have someone drive you there and wait and then do it, and it's like, it's
and there might not be a therapeutic arm with IV ketamine.
There was not. I was the follow-up later, but that wasn't really about that. That was more like you taking your medicine at home. Kind of.
Right. I think too, from a cost perspective, the oral ketamine can be less expensive because you don't need to have a nurse administer it and be in that kind of setting. But if we think about like my client, I'll call her Robin, who did have 2 sessions of ketamine. And right after that second session, it's kind of a felt sense experience of how she described the ketamine experience. The first thing out of her mouth was snow globe. And I was like, all right, I don't know where we're headed here, but I'm going to go with
Let's
snow
explore
globe.
this.
What is snow globe? And it took her a minute, right, to kind of come to what that meant and explain it to me. And she said, I feel like I had a reboot. Like everything
like
got
it
shaken
shook up. Oh, I love that visual.
Yeah, and the reboot, I haven't had this much quiet in here for a very long time.
I could see that being helpful for my eating disorder patients because of the food noise. I don't know why my brain just goes to that, but that's because that's my shtick. Because I'm like, the amount of, and even now, just like the sensory overload, the information overwhelm, like to quiet is such a gift.
And we know that SSRIs, antidepressants, take 3-4 weeks, sometimes longer.
And make it so you don't enjoy sex and you gain weight. And, you know, it's like, there was this meme I saw years ago that just is so true, but it kind of, you have to laugh at it because otherwise you cry. But it was like, me to doctor, I'm depressed. Doctor, I've got just the thing. Me, yay. Doctor, you also won't have an orgasm and you might gain weight and you probably won't sleep very well. Me, what? Like, those are my options. How is this supposed to help mental health?
And it's going to take a while.
So come back in 6 weeks.
Ketamine's fast acting. That Robin experienced relief after the second session. Now, that's not true for everybody, right?
Well, everybody's going to be different, obviously.
Right.
But people ask all the time with all the psychedelics, is it durable? And the research is still coming out on that. But it does look like with ketamine, some people need maintenance doses. And the other medicines, we could talk about psilocybin. People sometimes have a transformational experience on psilocybin and they don't need additional therapies.
Well, yeah, I've had 2 people in my life, one with ketamine, one with psilocybin, both essentially tell me that, and obviously everybody's different, but they went for a specific thing. Like, I'm going in because one of them was like, I have so much anger about like my childhood and the way my parents were, and essentially like abuse, but just the rage of it. I had already done like EMDR and like processed the trauma, but still felt such anger about the past. And ketamine, one intensive session of it, she felt like it was a reboot, and she was able to see her parents, who are both deceased now, but to like have compassion for them and like see it from their perspective, which she'd never been able to do. And it was that shift of perspective that it like gave her the freedom to move past it, which was like, like a godsend. And then another patient with psilocybin helped her with grief that she'd just been holding on to, and it was almost like she got to have a conversation she couldn't have had. So it's so wild to me as a therapist and so exciting. I can see why you guys get so excited about it, is because the thing that I think kind of really sucks about what we do as therapists is that it can take a long time.
Right.
And if you're talking about deep-rooted issues, the ability for someone to show up every week and actually go there and sit in it is hard, even for me as a therapist, like to go to my session and be honest and to sit with the discomfort and not get so dysregulated because I got a lot of other shit to do. I have my list of things. I have other, that's hard and it can take years.
Right.
But this is like maybe in a month I could feel some relief.
Right.
Amazing.
Right. It really does amplify and expedite. I think that as trauma therapists, that to expedite the reduction of suffering.
Amazing.
I mean, that's why we're doing this business in the first place.
And I
is
think
to
we're
reduce
all
suffering.
traumatized. I know that sounds
Yeah.
like a big, like people be like, I wouldn't call it that. I would.
I think they say 70% of adults have experienced at least one. I think it's probably more than that trauma.
COVID.
Yeah.
We all experienced it. Worldwide
Yes.
trauma. Fires in LA. I don't even live here. Couldn't even watch it cry just hearing about it. Like so overwhelming. It's in that, and we've been through how many fires too.
Right.
I'm like, how many times did I go through our apartment and be like, so what do we need? Nothing. Wow. Life is weird,
It's a hard fire drill.
Yes, but like I think sometimes we downplay our experiences to survive, but it's amazing to think that we could get a reboot, and I think that's really freeing and hopeful for people because trauma can feel like a life sentence sometimes.
Absolutely.
Yeah, I do feel this call to action to really bring forth awareness and education for people who don't understand the potential of psychedelics, but also feel like they could be involved in the conversation and start to ask questions the way we did in the beginning.
Yeah.
Right? Like, does this apply for me? And I want to know more. And that's my favorite kind of conversation.
Yeah.
I want the way I was blown away and to have somebody have that direct experience too.
Yeah, well, there's something it's why we love what we do, right? To watch it happen, to watch somebody have aha moment. Yes, because we can work for years with patients to get that one aha moment, and you're like, yeah. And those are those days when you leave, you're like, I'm good at my job. But other days you're like, I don't know what I'm doing.
I was like, I'm circling around the same thing. Oh my gosh, should I be circling around the same thing?
Right.
Or when the patient looks at you and like, are we just circling?
And
I
you're
was
like,
like,
I'm seeing if it's going to land. Clearly it's not. Go to the next airport.
I'm patient.
I think there's a recognition too that, and I don't know if I speak for myself or a lot of clinicians, like that there's a kind of arrogance, both in thinking that, conventional psychotherapy is right, the primary is the thing, and we also, I think what we're starting to understand about health and wellness, it's a shame, it's unfortunate that the way our, our health system is structured is that everything is siloed. I think there's an understanding in some circles that we need to have a more integrative, holistic approach for mental and physical well-being.
I couldn't agree more. And the frustrating thing as a therapist, I remember even working in the hospital systems forever, was try to get a psychiatrist on the phone to go over someone's file because you don't understand why they switched this medication. You're the one that has to sit with the patient.
Yes.
They'll never call you back.
Try to get a psychiatrist to call you back at all.
At all. And also then like even to regular doctor, like, okay, as an eating disorder specialist, I always send them out to make sure everything's okay and I can actually see them on the outpatient basis, which is not always the case. Tried to get them on the phone so you can talk through the results because I'm not the doctor and I know what they mean, but I want you to tell me what you think they mean because that's what I have to do. It's so, and the patients, they're the ones that end up paying for it, right?
Yeah.
Right. Patients have to, in many ways, take their care, be in charge of their own care.
Which, if you have a mental health issue, like,
Right.
I mean, I've been depressed before. The weight of depression, by the time you reach out for help, that's like the last, that you have.
Yeah.
And then to be like, oh, you have to keep pushing and keep trying. I'm like, that is not, like, whoever came up with this system has never had an issue in their life because it doesn't work.
Yeah. I think it's interesting, too. One barrier to entry on top of everything we're saying is fear. People are really afraid that, especially people we see who've experienced trauma, very afraid that they're going to re-experience their trauma in
Or
a
have a
not
bad
ordinary
trip.
state.
People are concerned about having a bad trip because I do get questions from my audience sometimes about like, well, how do we know? Because I've heard people can like do drugs and it can be good or bad. How are there any, because you said guardrails and stuff.
Yeah.
How do we prevent that?
Yeah, I do think it's the number one question we get of, I don't want to have a bad experience.
Yeah.
So I think maybe first we can redefine what bad means, because you can have a difficult experience that's actually...
Well, it's like therapy. You can have a tough session where you walk out going, what have I been doing my whole life?
Right.
I don't know how to process this. And it takes time to digest.
Yes.
Versus I was pushed too far, too fast, and I'm re-traumatized.
Yeah, I didn't feel safe.
Yes.
So maybe we talk about safety first. A bad experience is a practitioner that you don't feel secure with, that's not really following protocols, it doesn't, you don't feel...
How would they know? As a patient, how would you know if someone, like, what questions can they ask ahead of time, or how would they know if they weren't following protocol?
Yeah, I think it's important to ask if a person's been trained.
Yes.
Even if you don't know the training, that's a really important question. I think negotiating, these are just little things. In a non-ordinary state, it's really important to negotiate boundaries. Does that clinician talk to you about boundaries? Is there going to be touch in the session? Because in a non-ordinary state, sometimes a patient might want something that you wouldn't do in an ordinary state. So talking about boundaries ahead of time.
Yeah, because some people like touch, some people don't, especially when it comes to trauma.
Yes. Yeah. Right. And we're talking about therapeutic touch.
Yes.
Like grounding.
Yes.
We're not...
Like touch on the back
Back.
or arm,
Exactly.
whatever
Right.
feels safe for them.
Hand
And when,
hold.
if they're starting to dissociate, I don't know if that is a part, does that play into this too? Okay.
Oh, well, it can, yeah. I think what Alexa said is asking a lot of questions, doing some of your own research, and getting a real clear sense of the protocol. But something I wanted to touch on about a bad experience, I think, a good or bad, we kind of think, you get what you need and what you're ready for. So there is a component with psychedelics that connects directly to your unconscious. And this is why we can't really predict with any kind of certainty what's going to happen. That's sort of the X factor, right?
But that's what makes it special.
Yes.
But also maybe scary.
Yeah, absolutely. What we can be certain of is these are the protocols, this is what to expect, this is the proper dosing, these are guardrails, these are explicit agreements around touch and boundaries, all of those things to create the potential for you to feel safe enough so that you can go into your material. And sometimes it will be, let's say in the MDMA MAPS PTSD trials, revisiting old traumas. The idea is to be able to hold them, as we kind of touched on before, hold them in a way that's more spacious, where you're not reactivating the same trauma in the same way, but because the amygdala function is suppressed, and with MDMA, you're being flooded with all those very positive,
Say feel-good chemicals,
right,
for lack of a better term.
neurochemicals, dopamine, norepinephrine, serotonin, oxytocin. Again, you can hold something and look at it in a more expansive lens, and then hopefully reprocess it afterwards, because it's not going to have the charge. So back to trauma, and
Which is still like trauma processing, right? We try to get things to a point where they don't have any charge.
where they don't have the charge, and
Wow,
the trauma
interesting.
doesn't have the vice grip. That's kind of how you know. It doesn't have the vice grip or the charge. I
Yeah.
think that's what is so exciting, especially for the PTSD component to it.
When the amygdala is firing, and we find in people with complex trauma who've had like repeated trauma, their amygdala is enlarged because it's been like overactive for their whole life. And I find it really fascinating, because the whole goal of what I'm sure we all were trained in early on was like finding ways to calm the nervous system into some sense of like neutrality / safety. And you taught me that safety is not always the goal, because safety might feel unsafe in and of itself. But like that this is like almost like the MDMA or the psilocybin or whatever is like removing that hypervigilance component that keeps us held.
That's right.
And almost
Hostage.
like, yes, it is like, it's a cage.
Yeah.
And it's like letting us out of that cage where we're like, okay, well, if I wasn't reacting to this and feeling like it's happening again, then we're able to see things. It's almost like in my example of if I'm going to fight with someone, to see it from their perspective, I'm like, well, no. But if I don't actively feel angry, when I've had enough removal from it, then I can look at it and be like, I could see why that would upset them, which is a whole different perspective. This is like blowing my mind. I mean,
The amygdala quieting is one component. The other is there's this, like ketamine, for example, they're still seen in other psychedelics too. chemical called BDNF, which is like brain fertilizer. And it's fertilizer for the brain. The idea that there's more neuronal connections, so there's more connectivity.
Because I was going to say brain fertilizer. What does that mean?
Brain fertilizer.
But like it grows like more connections
Correct.
versus all the dendrites like dying or
Correct.
things falling off.
Or just the suppression of symptoms, that we're seeing new neuronal pathways, that neuroplasticity. And in that like greater connectivity, it's like that flexibility. In addition to the quieting, there's like flexibility in thinking. So I sometimes think of like the psychedelic as the fertilizer and the therapy as the seeds. Like it can absorb the seed because it's in more fertile ground. I think therapy is so much more effective when you're with a brain that's available.
Otherwise it's almost like it's like you're shooting it like rubber bullets, like bouncing off. Like
Yeah.
it just can't
Yeah.
get in.
Yeah.
Right.
Like I used to describe the behavior change, and I don't know why this visual works for me, doesn't work for everybody. So, but how our brain is like a balloon that's filled with sand, and then thoughts and actions are like rolling marbles across, and it slowly like makes these ruts. And so when you try to change something, it's hard to get it out of that rut. It's like, but I want to do this. This is what I do. I run this route.
Right.
And so, and it takes a long time for that new rut to be formed in a healthier way. But this is almost like you're filling it all in. You're like,
Right.
let's start over.
Right.
And then
It's like
this
a
is where we're going to put
supercharge.
the fertilizer. We want it here.
Yeah.
And you're like, it's almost like, oh, we're going to make the sand a little softer here. And you
Right.
roll it and you're like, oh, that feels so much less.
Right.
Right.
Like it
less work.
charges that possibility.
Yes,
Right.
versus it feeling like a muscle you've never worked before.
Right.
Exactly.
And you're like fighting against, almost like the wind is blowing in your face and you're like pushing. Because that's how behavioral change can feel.
Yes.
You
Against the brain.
consciously have to think.
Right.
Like I remember my therapist telling me, like, instead of withdrawing, because when I get upset, I withdraw because I don't like conflict. It's terrible behavior. She's like, when you want to do that, what if you leaned in and you say to the person, I'm feeling hurt. I'm like, I'd rather die.
Give me the script. I don't know how to do
No,
that.
thank you.
Yeah.
Was our 50? I think you're 50 minutes up. But I was like, for a while she talked to me about it, and she's like, just try it with a safe person, and and find it out. And I did that with Sean, where I was like mad about something and I was hurt, and I normally would like retract and be like, I'm just gonna go do da, da, da. He had no idea. It's like me internal, but instead I was like, no, I'm just gonna say like, hey, I'm sorry about that conversation. That hurt my feelings, so that's why I reacted. I'm not condoning it. I'm just explaining it. And he was like, oh, I had no idea. I'm so sorry. Like it was such from the outside, you'd be like, that's a very simple conversation. But for me, it was like life changing,
Right.
but it felt like into the
To
wind.
get there.
Ugh, like,
Yeah.
Right.
I'm like walking in the house. I'm like, no, don't go. Don't do it. Don't do it.
Like instantly,
Battle.
your drop-down menu of choices expands.
Yes.
And then you like have this
love that visual.
realization that you have that choice.
Yes.
And like, oh, I could exercise that. And I think often like if even in any of the disorders, there's such a limitation of action.
Yes, and
Whatever
choices
that
don't
is.
feel like they're viable.
Right.
It's almost, I love the drop down because it's like, when you're in a program that you don't know how to use. Like I was just using
Yeah.
Excel the other day, and like, no, thank you. But like, I drop down and half of them are grayed out. I'm like, but I need to do that. And that's how it is.
Right.
It's like
It is
it's
grayed
grayed
out.
out. But then it's almost
Grayed
like
out.
if you have psychedelic-assisted therapy, it's like they all turn black again, and you can click
Right.
on them as you need to.
Right. You see them.
Yes,
right?
you can
And
actually see them and read them, and you know what it means.
And you're like, wait, has this been here all along? Like, has this been just
Are people
sitting
working
there?
with like more choices?
I think so.
Yeah.
But the courage to keep exercising them is part of the ongoing support, which I just, because it does take courage to keep going.
Totally.
in that
So the
direction.
options for people now, it sounds like depending on where you live in the States, is all dependence. People have to do their research, but
Yeah.
psilocybin, ketamine, MDMA.
So currently, the only medicine that's FDA approved right now is ketamine, S-ketamine.
What's that mean?
S-ketamine, Spravato. So it's administered intranasal, and
So the pills we were talking about is not an FDA approved thing. It's still in the research phase.
well, it is off-label. So lots of medicines are used off-label. So
A ton of them, almost
ton of
every
them,
medication. I feel
right?
like.
So and
That's where
there's-
Viagra came, but if you guys don't know, it was actually a heart medication.
Didn't know
But
that.
then guys that couldn't get boners were getting boners, and they're
Oh
like,
my
"This is
God,
amazing."
that's a great finding.
Fun fact.
Because of blood flow.
Yeah.
Right, it's a
So,
blood flow. And
funny.
psilocybin in Oregon, they have a few clinics where you can go and get psilocybin-assisted therapy. Colorado.
British Columbia, I think, is decriminalized. And then Australia has approved both psilocybin and MDMA.
Oh, wow, wonderful.
Assisted therapy. So they're ahead of the curve.
Yeah. There's always those first ones. California's usually early on, but we're not, I mean, Australia's.
And we're getting closer. So Compass Pathways, which is doing research on psilocybin, there are phase 2 clinical trials for psilocybin. So it means, basically translated to, it's almost here. And again, MAPS is reconstructing the research design to get approval for their phase 3 trial. So when I say when, we don't know. I'm going to say a few years. But people interested, there's ways to get into research studies if you think you might be a good candidate for that. And there are, like I said, ketamine's a very effective, shorter acting psychedelic. People, when I talk about ketamine, I have a teenager, as you know, and he hears me talking about ketamine. He said, "Mom, isn't that like a street drug, ketamine? Is that what we're talking about?"
Like Special K or whatever they used to call it. It's like a horse tranquilizer is what people think of it as.
Or in surgery.
Yep.
Or in the emergency room. And so one benefit of it starting out, or us utilizing ketamine that way, is it's been so researched. Its profile, it's so safe.
Yeah, it's been around forever.
Forever. So I think that would be, it's a good starting point for people who want to explore this path.
Is it hard to get approval? Because I know a lot of people are like, what about insurances, or how do we even start that process? We don't have to get into that if we don't have a ton of.
Yeah, we can. I think access to care is an issue in this country. So first and foremost, I want to say, and it can get expensive. So ketamine clinics are expensive because of the things we said earlier, which is you need a nurse or a doctor to administer the IV ketamine. But oral ketamine can be administered in a therapist's office. And even for people that qualify, I know this is going to sound a little out there, you can do remote.
Yeah, there was a woman online, she's another YouTube creator, and she's been doing ketamine at home. Yeah. But her husband did like a little, I wouldn't call it a training, but the therapist briefed him on like how he needs to support her. And so they do that.
Right, like a chaperone.
Yes.
So you need to have a chaperone there.
Okay.
And oftentimes it's, you have some established rapport with a clinician that you're working with remotely. And for people that live in remote areas, it could be a godsend. Do I think that's ideal for everybody? No. But for people suffering on the edge of, I don't think I can go another day.
Yeah, is this my whole life? It's always
rainy.
I feel like this is terrible.
Yeah, I think it offers an outlet and some relief and a potential. Because I think when something lifts, even if it's for a short term, even if you need ongoing sessions or doses, just the potential that it doesn't. I remember something Robin said to me. She's like, I just felt like I was my depression. To know that I'm not that.
Yeah, that's not my whole personality. Right. Because we can't see out of it. And that's why, like, we always externalize as therapists. We're taught to, give it a different name or call it your depression or say this thing I'm struggling with. But when it's so palpable, it's hard to even know what's left of us without it. Right? That's like the eating disorder kind of puzzle, is like, how do I imagine a life without this when I've defined myself so much by it for so long?
Right. It becomes like an organizing principle.
Yeah, and like if I take that away, do I just crumble?
Right. Yeah. I do want to say, we're very pro psychedelic, and two things. One of the reasons why the FDA did not approve the MAPS clinical phase 3 trial was there was a question about what is going to be the sort of supervising body that oversees this type of.
Oh, gotcha. Like who do we have that's going to watch this and make sure it's
like
created
the
same way?
Right? Because there's a compound and there's a therapeutic component, and it doesn't exist. Yeah. So who's in charge of creating that? And I think
we need to get certifications in some form,
certifications,
or licensed in
but
some.
like, is it a national governing body? Is it like right now it's all the states, and as we spoke about the silos, right? So pharmaceutical is over here, therapy is over there.
Yeah.
So who would create this governing body, and what does that even look like?
Yeah, it's complicated.
And we're firm believers that it should be regulated.
Yeah.
Yes, and I agree because
Yeah.
unfortunately, otherwise we'll get bad actors, and then we'll have
Yeah.
Exactly.
then people will be exploited, and bad things can happen.
Right.
100%.
Which is why it's important to ask questions, talk to your
Yes.
clinician, find out if they're trained, all of that stuff.
To your
the
point.
things.
Right.
And also, it's not a panacea for, it's, even though there's so much research and also excitement around it, just like anything, a person's health and well-being is complex. And it's, even though it can be a healing agent and a transformative experience, it's not like it's going to solve all your problems and you won't have to ever go back to therapy or, ever do other things that you need to do to be well.
I mean, nothing's a magic bullet.
Exactly.
That's kind of always the important thing to remember is like, we still have to do the work.
Yes.
And we still have to make changes. This just almost like greases the wheels of it. It allows it to happen more quickly.
Yeah.
Yeah, like our drop down could be full of
Right.
options.
Drop-down could be full.
Yeah.
I think, Shira, just to piggyback on what you said, the vulnerability that comes in a non-ordinary state, we can't understate that you are vulnerable. You are vulnerable in the therapy session. You are vulnerable after that therapy session. So we're looking at, obviously, the training of the clinician, but also partner. Are you going home to a partner that supports this decision? Are you going to a home that's safe to hold what new menu options you have? That also really does need to be evaluated.
And that's normal for trauma therapy too, right? Because
Yeah.
I'm a firm believer in like you can't heal from a trauma if it's currently happening. Like, because that just puts you in a very dangerous situation where you're like opening yourself up only to be wounded more. Is this kind of similar in that?
Or like going back, you've just come out of rehab.
Yes, and going
you're
right back in.
Going back into the system, yeah.
And that's always hard. It's like that's the hardest part of rehab and addiction is that you go back in and you have the same friendships and you have the same people, and like it's really hard to say
Same
no if your
triggers.
whole community, your whole life is around addiction. Just as a random question, are there any hope for addiction recovery when it comes? Because it almost feels like it's like no. Use a street drug for addiction assistance, but I could imagine it allowing people to see things differently, right?
Yeah.
To heal. I mean, addiction's a coping skill, so for probably trauma, things like that.
I think they're seeing major gains with psilocybin.
Yeah.
I think what the biggest disruptor is that, and I'm not saying this as a point that, alcohol dependence, we'll say any of them has been treated like a disease. So I think it's really changing how we're thinking about addiction when it's seen from a different perspective.
I know that you two do a lot of couples work, and that's your primary focus. Is that fair to say with the work that you're doing? Can you tell me a little bit about how that works? How do you pick couples? If someone out there is struggling in the relationship, what should they look for? How would they know if this is a good fit? All the things.
Again, like a couple, just like we said earlier about an individual having some self-awareness in a couple system, they would hopefully have had some work, either individual or couples therapy. They are aware of their patterns. They're aware of their conflict cycle. Most couples come in and are like, we can't communicate.
Right, we don't have sex. We can't communicate.
We can't communicate, right? We're not intimate.
We always blow up with each other or whatever.
Yeah, exactly. Or sometimes deeper problems like a betrayal or an infidelity or something like that, or a big life change that's really hard to move through, like empty nest or something like that. So I think a lot of the same things apply in that sense. And the experience looks a little bit different because it's more interactional or more relational. So they might have the mask on, but then start actually talking to each other or holding each other or just gazing into each other's eyes. So I think what's beautiful about couples assisted therapy is that it creates this deep sense of compassion, and you're in a bubble of relative safety, and the same principles that you can hold difficult material, maybe a toxic narrative about the relationship or about the past or about each other.
Yeah.
And when the ego softens, as you were saying, Katie, earlier, you're not as defensive, your walls aren't totally up, you're able to tolerate more complexity. And I think that is one of the things we didn't touch on, but we absolutely should, because what psychedelics sort of allows you to do is to be more elastic, right? To tolerate, I think, the things that are so hard for many of us to tolerate: ambiguity, lack of closure, anxiety, ambivalence. Like, these are the markers of healthy adult consciousness, the capacity to tolerate complexity and ambivalence.
It's like emotional intelligence.
Yes, it is.
Which is very far and few in between, unfortunately, because it is hard to hold a different perspective. It's hard to not get defensive. It's hard to not repeat the same thing you've told yourself over and over because you believe it's fact.
Right, about who they are and why they do what they do.
Yeah.
And here
and
it
who
comes
we are
again.
in this, and our role or our lack of a role in this.
Yeah.
And there it goes again.
And like we tell ourselves that story.
Yeah.
And I think we talk about narratives in therapy a lot, like changing the narrative, but that is so difficult because we've often been telling ourselves that story for how, like I'm 41. So for 41 years, I've been telling myself this story, and it's hard to all of a sudden one day wake up and be like, that's not true.
Yeah.
I think the other thing that we see a lot, in addition to the story softening or evolving, is also remembering love. Like that bucket that's empty because you're managing so many things in your life and tending and task mastering, that there isn't the same quality time to actually remember who fundamentally each other, like why we started this in the first place.
Yeah. Why did we fall in love?
Yeah,
Why are we in this relationship?
Why are we here?
Yeah,
And is that still here between us when the noise softens? So I think that filling the bucket on top of rearranging story is that you can draw from that when things get hard. You kind of have a reserve. And I think that knowing that we can kind of dial back in to that place, some couples have never had that place, and some couples it's a rediscovery of that place.
Yeah, because I feel like in early stages of relationships, when you're super in love and everything's wonderful, you have so many good experiences together, and the bad ones and the stressors are just few and far in between, could because of your age or the level of relationship. And so you are like filling that bucket. But then if you don't continue to do that in your life, then it's like a savings account. You're depleting it. You're not giving to. So this is like almost like making a big deposit.
Oh, I like that.
Yeah, deposit.
I like that. It's a large sum.
Yeah.
It's a large sum. So I think we all need that.
But I do
windfall.
think too that the lives we live conspires against intimacy, and I think what the wall that I see repeatedly is that a couple will come in and this is their time, they can't drop in to be slow down, be present. Similar to like physical intimacy, you have to shift gears and like move everything away so that you can fully be present and curious and open and receptive to each other. And couples can't white knuckle it. We cannot do it.
Yeah.
You know, you could say like, oh, these are the techniques and this is what we're supposed to say and do, and
I
they can't.
appreciate you doing that. Like repeat it.
My positive ask is.
But sometimes it feels like, I've said this to Shira, I sometimes feel like I get to just witness pillow talk. And couples that can't ever soften enough to have that pillow talk. And I just have the honor of witnessing that pillow talk.
How beautiful, though. Because I think we do, like, I don't know what it is about our society, but like intimacy, like emotional or physical intimacy is so like not important, not valued enough, not something that we, I don't know, like people get so excited about how much you earn and what you do and all, but what about like who you are and the people you're connected with? And like, we don't spend enough time, I don't think, emphasizing that importance and that value. And so it's like you get to watch the rebirth of a relationship, like the closeness again. It's like
Rekindling.
Yeah.
It's really magical. And I think that we are obsessed with, like, why are we so obsessed with Esther Perel? Because she speaks to all the complexity and how difficult modern love is and all of our expectations, and yet we don't know how to get there. And I think specifically with MDMA, but you could do it on other medicines, you don't have to force. It just envelops you in this like hug.
Yeah, because it's like giving you all those feel-good chemicals. Yeah, because because compassion is hard to give, if we're wrapped up in like an old nasty story about who we are, about who this person is, or we're caught up in this narrative that we've said over and over and over about how bad this is or how wrong this is, it's like hard to see out.
Yeah. I liken it too. Like we have these private conspiracy theories about our partners.
Yes, we do.
Conspiracy theory was like, she doesn't care about me. If she cared about me, you know.
Yes.
And I always
they're doing this on purpose.
They're doing
I swear
this,
they didn't
totally.
put the toilet paper on the roll because they know it agitates me.
They leave the toilet seat up. And here's the
clearly
thing.
neglecting
There's a
me.
connection between conspiracy theories and the conspiracy theories we have in our relationships, which is like negative repetition and reinforcement. Like, how does a conspiracy theory like root in someone's consciousness? It's because the algorithm just keeps reinforcing it.
Yeah.
And I think that's what we do in our relationships.
Totally. It's like it fills your FYP.
Yeah.
You know, and you're like, all these videos that you're watching, all
Right.
these things you tell yourself are all.
This attentional bias.
Yes. And I think that's like, we talk about self all the time, like, like understanding when you have negative self-talk and like recognizing it. And I talk about bridge statements a lot. Like, we're not going to believe the positive, but you can at least believe like, maybe I'm not as much of a dirtbag as I think I am. Maybe, right? You can just at least be open to the possibility. And I think we never talk about that when it comes to relationships. We have to do the same thing because we've been telling ourselves this story, and it's not true any more than the negative self-talk we have about ourselves.
Well, it's not working.
No, and it's making us uncomfortable and unhappy.
Yeah. So I was driving with my 15-year-old. I guess he's come up twice today. And he's in the back of the car. We're driving home from the Super Bowl party. And he looks at us and he goes, you know, I just realized something. And he like points to us. He goes, if this isn't working, nothing's working.
Oh, wow.
I was like, did he just say that? Because sometimes.
And from him, that's such a surprising.
Wow.
Because the truth is.
Insightful.
The truth is.
I know.
Also, that boy of your
when
two
he
boys.
But when he said, he was right. The house, the home, that nothing
their
works.
life, nothing
nothing works if that's not solid.
Well, then imagine children of divorce. Like that explosion of life, right? It can feel so jarring and like nothing operates. And that can feel that way for us too. Like whenever you watch, I mean, luckily I haven't experienced any kind of, divorce in my life in general, but like my parents, Sean and I, everything's been hunky-dory, I guess, but that is so life altering because you build this with a person and even friendships, you build things with people, and it can be so disruptive and so dysregulating to have that rocked, I really think that the couples work is so powerful and something that we don't talk about enough because of the fact that I know as a therapist, I don't do couples work because they wait too fucking long to come in. One of them always talks over, they're usually the woman, but not always talks over the man, depends on the dynamic of the relationship and who the couple is. And one of them is already checked out. And I did some of couples work early on and was like, this is exhausting. And I felt like a referee. And I was like, this is not the role that I want to play. Like, because you don't see your role, and you're just yelling, and I'm like trying to calm you down so I can hear from each of you. And that's why I love the show Couples Therapy, because she's so good at it. But I don't think we talk enough about why we wait so long, why we get stuck in those patterns, how hard it is to get out. And it's great to know that there are other resources out there for people, because asking a couple to go to therapy is hard enough to get both of them on board. Asking them both to do their internal work on their own is not only expensive, if they're in their own therapies, but then also time consuming. And again, one is probably already checked out. So it's really great to know that they can have these other experiences where the ego is quieted, where they can maybe see things from another perspective, or even younger them. Like, remember when you fell in love? Remember that happened.
When couples look at each other and the soldiers that normally defend them are down, like the guns are down, and they're seeing each other at that undefended place, and seeing, you said, even seeing younger parts of them, redefining once again based on knowing that person more intimately because of the experience that they're going through. When the soldiers are up and the guns are out, there's no new learning happening.
No, you aren't open to it.
Yeah.
It's all about winning. Like I remember I read this article by Leandra Medine. She's a fashion lady, but I just love, her way with words is beautiful. And she described listening and how sometimes we listen to win. So we're not really listening. We're looking for our counterpoints. If you say this, I'm going to say that. Oh, they said that. Oh, I've got a better one of that. Like, you think you did that. So we'll listen to win the argument, or we will, the goal is to listen to learn, essentially. You need them to teach you. You can't go in thinking you know everything. You can't go in thinking that you're better than them. Or listen to fix was the other. I was like, it'll come to me in a second. We either listen to win, listen to fix. Like, I know better, I can do, which is a therapist. I'm always like, that's a hard one. But you have to listen to learn. And couples we often struggle to do that because we're trying to win or we're trying to fix, make it better. We have more shit to do. I don't have time for this.
We're trying to be right.
Yes.
We're busy trying to, and I think on the medicine, time slows down. You're not in time anymore. So that's part of it. I think the potential to have a sustained reparative attachment experience is really the biggest value proposition in the couples work, because you're there, it's hours, it's 6 hours.
Oh, wow. I had no idea.
So this would be
MDMA
when it's approved. So we're saying it's coming down the pike.
Yes, but that's what it looks like. That's what we're looking into.
When have you gazed in your partners? I don't want to say for 6 hours, but for a long period of time. So much healing can happen in when there's that much attention and focus and compassion. It's like the magic cocktail, right? To rekindle that spark of love and also trust.
Which is huge.
There's nothing like it. And I really believe that you can leverage that experience into any of the existing modalities. Like, there's not like, it's got to be EFT and it's got to be Gottman. You could take that, the full cup, that feeling of rekindling and love and connection, and then in your integration, leverage it all back, all the tools you have, because now you don't have to grit your teeth and say, okay, I'm doing this, but I want to do this. Like, I know this will feed my relationship. And so bring all that awareness and insight back into your couples work. It's so rich. And I think that's how you get durability. Like, that's how you sustain the experience versus like going for some retreat in Costa Rica
and then coming down.
And then coming down.
Yeah, it's like the addiction. You get out of the treatment facility, you go into real life. Like, how do you keep that going?
Totally.
So one last question, and then if there's anything else you want to add before we wrap up here. But I've heard from people in my audience that like things aren't really available and people are trying to do this on their own and like grow their own mushrooms. And can we just tell them no? How would they know how? I'm concerned for people sometimes with that.
I think I feel the same concern you do with respect to people getting it from an unknown provider or supplier, not knowing dose, not knowing necessarily if they're appropriate for that medicine, or they're in a safe place, or a safe person is with them. There's so many ingredients that create a therapeutic container. And so when people do it willy-nilly, I'm not saying it's always a bad idea or unsafe. I'm wanting to hold that very tenderly and carefully and safely for people, that to go to a skilled clinician.
Well, there's no therapeutic component, right? Because it's like the same reason why I can't therapize myself. Do you know what I mean? Yeah. Like, I can't sit down and be like, Katie, here we go. Like, that's just not how it's going to work. And because I need somebody else with the insights and the abilities to meet me where I'm at and challenge me, even if you do get into the ideal state with the right dose, which is already its own, like, well, how do you do the work?
More importantly, if you get into a difficult spot.
Yeah. How do you get out? How do you move through it?
Because you are tapping into the unconscious and you don't know what's going to come forward on a medicine where you're not clear about the dose, you're not clear about the source, what if it's laced with something, you don't know if you have the proper kind of support. So we're not going to sort of minimize that there isn't the potential for people to have challenging experiences. So I think, yes, we're not advocating do it at home, good luck. But I think it's coming down the pike, and it's something to pay attention to, and And it will be more available probably in a few short years. It's
How do
really
people
exciting.
keep up with that stuff?
Yeah.
How do they, can they follow you guys? What can we do next?
Yeah, so you can follow us. We'll give you all of our information.
I'll link it in the description for
Yeah, and website, our channel, and how we're going to bring information, but also maps would be a wonderful. We'll link that too, and compass pathways, and maybe we'll list a few other major institutions doing research right now.
Johns Hopkins. That's right.
I think that advocacy of people asking for it, supporting psychedelics, I mean, we absolutely can have an impact on these therapies coming faster with the kind of guardrails that we're talking about. So when it does come to the public, it's administered and available in a safe way.
Yeah, wonderful. Because I feel like sometimes, things that are approved or not approved can feel kind of out of our control. And so if people can advocate or, call your congressman or whatever to advocate for it, because even Sean and I spending the short time we have in DC for some mental health summits and stuff, there were people there advocating for the approval. And I was like, wow, there's so many other ways we should probably get behind this stuff, because I didn't know. And I try to stay abreast of everything, but there's a lot to do. So I'll link things in the description so that you can follow along. You can advocate for the approval of these alternative treatments. Thank you both so much for spending time with us today.
Thank you for having us.
a pleasure.
Sharing your expertise, so
Yeah,
interesting. I
thank
feel like
you.
there's a zillion conversations we could have, so I'd love to have you back.
Yes, so much fun.
Thank you.
Thank you.
Thank you, Katie.